Okay, I think we are ready to go. And welcome everyone. I am Marie Story, Corporate Wellbeing Consultant and Team Leader from Walsh Duffield. Thank you for joining us for today's webinar addressing mental health in the workplace, presented by Melinda DuBois, Executive Director for the Mental Health Advocates of Western New York. This webinar is part of Walsh Duffield's Summer School series, where we will be hosting a different subject matter expert each week to discuss some of the hottest topics surrounding insurance, employee benefits, and challenges we're facing due to the pandemic. If you haven't checked out the rest of our lineup, be sure to visit walshduffield.com/summer school for a description of each presentation and for links to register. Before I introduce Melinda, there's just a few housekeeping items I want to go over. Today's webinar is being recorded. We will share the link with you after the event, along with the presentation slides. This presentation is approved for 1 SHRM professional development credit and 1 HR recertification credit hour through HRCI. We'll email the code needed for these credits to live attendees after the webinar. And we invite your comments and questions. Please use the Q&A box on your screen. If you think of a question at any point, just type it in here and we'll hold it for the discussion portion at the end of the event. And with that, I'm going to introduce today's presenter. Melinda was named the Executive Director of MHA in September of 2020 and has over 25 years of experience managing multidisciplinary health and human service organizations. She's a respected administrator with a reputation for building relationships and coalitions, and has served as an advocate in Albany and Washington, D.C. Before MHA, Melinda was the Vice President of Health Services at Planned Parenthood, Central and Western New York. And prior to that, she was Administrative Director of Student Health and Counseling at SUNY Geneseo, Executive Director of Buffalo Women's Services, and a Clinical Coordinator at Baker Victory Services. She's a current board member of Horizon Human Services, Vice President of the Care Management Coalition, a member of Health Leadership Fellows Cohort 6, and past president of Crisis Services Board of Directors. And she's a 200-hour registered yoga instructor trained in trauma-sensitive yoga and meditation. She's a graduate of SUNY at Buffalo with a Bachelor of Arts in Psychology and a Master's in Social Work. And Melinda currently resides in East Aurora, New York with her husband, daughter, and her Black Lab, Yoshi. So today, Melinda will be sharing insights and tips on how to address and support employees' mental health and well-being at the individual and the organizational level. So at this time, I'm going to turn it over to Melinda, who's going to start today's presentation. Thank you so much, Melinda.
Thank you, Marie. It's so wonderful to be with all of you today and to talk about this really important topic, which I'm really passionate about. So bear with me because there's a lot of slides and a lot of words, but it's really such an important topic and a really timely topic. So we're going to talk a little bit about addressing mental health in the workplace. We're going to talk about what's currently happening in the workplace, really around COVID and mental health. And then we're going to talk about strategies for what we can do to really support our workers' well-being. And then we'll end with some resources and a Q&A. So I'm hoping that you can spend the next hour really unplugging. So disconnecting from your phone and from your email and really being present here as we talk about such an important topic. So important to really kind of breathe and be in this space as we're discussing. And if you have any questions that you'd like to ask, please remember them at the end. Thanks. So just a little bit of a brief introduction to the Mental Health Advocates of Western New York. So I was named the Executive Director in September, what I call a COVID hire, because for any of you that were hired during COVID, it's been an interesting time for us. The Mental Health Advocates of Western New York has been around for about 60 years. Our previous name was the Mental Health Association of Erie County. And our mission is pretty simple. It's really to promote mental health and wellness in our community and support individuals and families challenged by mental illness. We have a lot of programs within the mental health advocates. We work with families, we work with people in the court systems, we have a CASA program, we work with children of the military. It's really quite an amazing organization that does a ton of good work. So let us start with a little story, if we can. So, I'd like you to think about two workplaces. So we have a workplace called Pressure LLC and another workplace called Peace and Love Inc. All right, silly titles, but I really wanted you to think about what two different organizations might look like. So picture Pressure LLC. This is an organization that really promotes productivity, and they expect all of their workers to be highly productive. They use words like productivity and striving. They stress competition among their workers. Everybody in the organization is expected to work at least 50 hours a week. They frequently get weekend emails from their boss. Sometimes their boss emails them in the middle of the night. Taking a leave is discouraged. And they say, leave your home life at home. When you walk through this door, your mind should be on work. Frequently, when you're using the restroom, you see people talking, using, that private space to talk with their children who might be calling them from, checking in with them during the day. Really, what they do is they promote people who work really, really hard. So if you're working more than 50 hours a week, if you're really striving and you're highly productive, you'll probably get promoted. So that's Pressure LLC. And now let's think about Peace and Love Incorporated. So at Peace and Love, staff bring their whole selves to work. They have flexible schedules. They take mindfulness breaks. There's a lot of laughter and joy. People talk about their home lives, their children, their pets, their families. They take some space to think. They start meetings sometimes with a quiet time so that people can be present in that space. They have no meeting Mondays. They encourage staff to attend their children's events. And they have an emphasis on people and quality versus productivity. So if you think about these two workplaces, where would you want to work? I think what's important to think about is, how do we promote mental health in the workplace? And why is this important? What we know is when organizations care about employee mental health, they put in practices that support their well-being. They create a culture of openness and caring, and they support and help improve employee mental health. Employees are happier and they're more engaged. And the organization's reputation improves and their retention rate improves. So basically, supporting employee mental health really impacts your staff and your business, and it creates a situation where we all thrive. Not only do the workers and the organization thrive, but the organization thrives as well. So really, in order to address mental health in the workplace, we really need to look at our workplaces and the culture and the policies that exist. So MHA, which is Mental Health America, the Mental Health Advocates of Western New York, is an affiliate of this national organization called Mental Health America. They did a survey called Mind the Workplace in 2021. And you can see from this slide and the results of that Mind the Workplace survey that we are basically all stressed out at work. So 9 out of 10 staff say their workplaces affect their mental health. 4 in 5 feel emotionally drained at work. The work environment does not feel like a healthy place for most of our staff. And the staff do not feel supported. We're going to dig a little bit deeper into that fact that that staff do not feel supported in later slides. But I think it's really important to take a moment to acknowledge the fact that we are all feeling this enormous amount of stress right now in the workplaces. We know that it's increased during COVID, so it didn't start with COVID, but we also know is that we've created this culture in our work settings that is causing a lot of stress for our workers and a lot of dissatisfaction among our workers. Here's another survey. So Wellwright State of Employee Health and Wellbeing 2021 report asked this question: which of the following mental health related issues have your organization's employees dealt with in the last 12 months? So this took place in 2021. Just look at the responses. Interesting and funny. Select all that apply. I think that a lot of people could select all of these things. Look at the level of anxiety, depression, stress, loneliness, and social isolation that people are reporting. What this shows us is really our employees are dealing with an enormous amount of stress in the workplace. In fact, 46% of Americans will meet the criteria for a diagnosable mental health condition. 9 in 10 employees say their workplace stress affects their mental health, and 3 in 5 employees do not feel their employee provides a safe environment for those with mental illnesses. And I want to pause here to really think about these statistics. And we're talking a lot of statistics, but there's been a lot of focus on mental health right now. Thank heavens there is, because everybody's recognizing that COVID has created this heightened sense of anxiety, depression, and loneliness. And more people are talking about mental health. They're talking about mental health in the workplace. And we're recognizing that we really need to make a drastic change. I think for many of us, we keep hoping to go back to some kind of normalcy, some kind of time before COVID when the world wasn't so different. But in reality, I'd like us to think about, do we really want to go back to that place? Or have we learned some things during this time where we've been dealing with this pandemic that we can bring into the future of our workplaces? So what does the COVID workplace look like? And why are we all struggling? I think it's obvious, but it's important to really name what's happening to all of us right now. Think back to the beginning of COVID and think about, for many of you, you may have been an essential worker. So essential worker meaning a hospital employee, or maybe you work at a grocery store, or you work in a place where you had to physically be at work. You couldn't work remotely. So think about the burdens, the feeling of overwork, the times when members of the public who weren't always polite for new safety, public safety protocols. I can think back to going to Wegmans in the early stages of COVID and staff there having to ask people to put their masks on and people refusing. That is an unexpected stress for a lot of workers, and they had to manage that stress, as well as the fact that there were so many people who were ill, and so a lot of people that were healthy ended up working double and triple shifts. The people that were working remotely from home were housebound and isolated. So for some of us who were working from home, you may have not have left your house for weeks on end. And we kept talking about home being the safe place. Staying at home was where you felt safest. And so that creates this kind of sense of isolation and loneliness. We experienced the trauma, really the collective trauma of rising case counts and fear over the health of our loved ones. And for some of us, we may have lost people in our lives. Parents have found themselves having to figure out how to be full-time staff members and full-time teachers or caregivers. And on top of this, we are dealing with political upheaval, systemic racism, and political polarization. And now we're dealing with the new Delta variant. What is happening now? Are we able to go back into our workplaces? If you're in your workplaces and you're not wearing masks, do we need to wear masks again? All of this uncertainty really increases our stress. And what is the effect on our mental health? Again, MHA, the Mental Health America organization, did a work health survey in 2021, and they found that not only were people feeling stressed, but 1 in 10 employees said they considered harming themselves or harming others. Mental health care providers saw a 33% increase in suicidal thoughts among their clients. And employees were 3 times more likely to be diagnosed with depression or anxiety. And now that COVID restrictions are being lifted and offices are opening again, employee mental health is actually getting even worse. Again, with this uncertainty, with this shift from working at home and coming back into the office, and with all of this just really not knowing what the future is going to look like, it's created a lot of stress for a lot of us. And there's another component which I think is important to think about, and that's financial insecurity. Almost 60% of people worry they won't have enough money to pay for their living expenses. We know that people have lost their jobs and they don't have enough money saved for an emergency. 1/3 of study respondents said they couldn't pay for their health care. And a recent survey reported that nearly 46 million people have wiped out their emergency savings. So people who are working are stressed, and people who have lost their jobs or have lost their financial security are facing an enormous amount of stress. And a lot of employees say they can't concentrate in their current work environment. And again, about 56% of employees feel their employee does not create a safe space for people living with mental illness. So it only follows that over half of employees are actually looking for a new job because they can't imagine going back to the job that exists right now. So let's talk a little bit about this, what I call this disconnect between what's going on in our workplaces from the employer's perspective and from the employee's perspective. Really, there are different opinions. In February of 2021, Ginger did their third annual Workforce Attitudes Toward Mental Health report. And they demonstrated this problematic disconnect. So when you look at this slide, you can see that 94% of employers think they're doing enough to support mental health. And yet only 69% of employees think their workplace is doing enough to support their mental health. 70% of employers say they are accepting of mental health challenges, but only 35% of employees think their workplace is accepting of mental health challenges. So there's a huge discrepancy here. This disconnect is really important to think about. 84% of CEOs feel their company was successfully addressing employee mental health and morale during the pandemic, yet less than 1/3 of employees strongly agreed. So people that are leading organizations are feeling like they're doing enough to address their concerns of their workers, and yet the workers are feeling like their workplaces are not doing enough. It's really important to think about this because there's a huge disconnect. One of the reasons why there's a huge disconnect is because of this word stigma. What's become clear is that employees want open and honest discussions with their supervisors about job stressors. And when those discussions don't take place, it becomes a source of job dissatisfaction and mental health issues. So really, stigma is present everywhere, and it's standing in the way of us really understanding our employees' needs. The stigma around mental health is, according to NAMI, is really important because it delays treatment. So some people really suffer with their mental health concerns for up to 10 to 11 years before they address treatment or get the treatment that they need. So could you imagine if you had a broken bone in your body and you waited years and years to actually get that fixed? What's happening here is because of stigma, a lot of people are ignoring the symptoms that they're having and waiting for a long time before they get the treatment they need. It would be so much better if they had early intervention and learned coping skills before they experienced a crisis. So for workplaces to truly be successful in addressing employee mental health needs, they need to take a different approach. And it really involves a fundamental paradigm shift. So this is one of those reasons why I'm so passionate about this topic, because it's not as simple as just adding a couple of resources to your workplace. It really requires this really 360-degree turnaround, a real fundamental paradigm shift to adequately address mental health needs in the workplace. And in my opinion, it starts with compassion. So it starts with compassion for ourselves and for each other. And it's a universal compassion. What I think we've learned during COVID is that we really need to figure out ways to take care of ourselves, our physical and mental well-being. We need to figure out ways to take care of each other. And as a society, when we're more compassionate, then greater things happen. And we know that when we feel empathy and compassion for each other and for our coworkers, we are better workplaces. So compassion is really important. And the other subject that is really important is a term called psychological safety. So psychological safety basically means that workplaces allow people to speak up without the risk of punishment or humiliation, so that people feel comfortable speaking up when they disagree with the status quo, when they disagree with the group or their team. Managers really need to create an environment that encourages employees to share aspects of their personal situations as relevant to their working schedule or location, and to trust employees to make the right decisions for themselves. It's really much more than just being nice. It means that we create cultures in teams where people can bring up issues without fearing blame, fearing judgment, being ignored, or being dismissed. And what that really means is that we feel valued as workers. So psychological safety basically means that we value our employees and we value where they're coming from, and we want to hear from them. So what we really wanted to talk about is the fact that investing in our people is really embedding mental health into the workplace. So it's not just a separate activity. A lot of us are really lucky to have EAP programs, which are so fundamental and essential. But for many workplaces, that's a separate thing that kind of stands out there. And what I'm encouraging people to think about is, how do you incorporate mental health practices into the workday, into the work culture? So really developing and designing work with wellness in mind by tapping into what will create the best working environment. And that means really unleashing worker potential. So we were talking about thriving versus not just surviving, but having a thriving mindset. In a thrive mindset, employees are empowered to identify the skills and areas of development that align with their interests and passions. So you recognize what's most interesting to your staff and what they're most passionate about, and you cultivate that with your workers. Employers can help people grow into the positions at which they're skilled and enthusiastic. And that's really a winning recipe for emotional well-being. And then there's this creation of something called super teams. So think about your coworkers and think about the teams where you work. This concept of super teams really emphasizes diversity in teams, diversity in thinking, bringing your own style of thinking to the table. And employees are valued for not just what they think, but how they think. And we really encourage differences. They're not just accepted, but they're appreciated. So that we're not creating these teams of yes people, but we're creating teams where everybody's perspective is welcomed and encouraged. So what does it mean to develop a person-centered workplace? Again, think about Pressure LLC and Peace and Love Inc. So really, Peace and Love Inc. is a person-centered workplace. It really emphasizes the people and their well-being. And what we know is that when organizations emphasize people's well-being and people's mental health, the organization thrives. So it might seem obvious, but when companies get employee input before designing the strategies and policies that will affect their employees, workplace emotional well-being will improve. What we know is that when heavy-handed top-down policies are enacted, that more often than not, staff do not feel valued and they do not feel like the workplaces support them. So how do we develop a person-centered plan? So these are some what I consider essential steps to really supporting mental health and really looking at that paradigm shift. So what do we need to do? So one of the most important things we need to do is train our supervisors to provide emotional support. Now, if we think about Pressure LLC and that organization, people don't talk about their emotions. They don't talk about their feelings. In that organization, they aren't encouraged to. Again, remember, work is for work, home is for home. Don't bring your home life or your stresses from home to work. But what we're encouraging supervisors to do is to learn how to provide emotional support for their staff. Another thing that I encourage you to think about is developing what's called mental health ERGs or employee resource groups. So if you could think about your workplace and having an advisory team of people that struggle with mental health concerns. So maybe they struggle with anxiety, depression. Maybe they have family members that also struggle with anxiety and depression. What if that group got together and met regularly and provided an advisory capacity to the CEO so that policies, procedures, workplace culture could really reflect the mental health of the staff. Another suggestion is to really designate a mental health advocate who can help employees figure out where to go and how to get care. So remember how we talked about embedding those things into the workplace setting and not having them separate. So if you had a team of people that were trained to be mental health advocates, who would be able to be really wonderful listeners. These are not professional clinicians, but your coworker who is a really good listener. And you know when you're struggling that you can go to that person and that person can help you get the care that you need. We also recommend encouraging employees to talk to their supervisors and encourage supervisors, again, to listen with flexibility and to keep an open mind. So encourage employees to talk about their job stressors and how to remove them, and encourage supervisors to listen carefully to what their staff are experiencing when it comes to job stress. Again, it's the encouragement of talking about what's happening versus saying, well, you know, everybody's stressed out here. Everybody's working hard. I remember sitting in a team meeting in one of my other jobs, and it was a team meeting of all directors, and we all sat around the table and each director talked about what was going on during that week. And everybody was talking about all the things they were that were on their schedule and how stressed out they were, how many hours they were working that week. And as I was sitting there, I thought to myself, this is the culture that we've created. And certainly our boss encouraged us. He would be considered a workaholic. He encouraged us to work many hours. And I thought, what would happen if I said, you know what, this is an easy week for me. I'm taking some space out of this week. I'm scheduling some free time within my schedule so that I can really take some space and think about what my goals are for the next month or so. I'm going to do some self-care strategies. I need a couple of days where I can just really concentrate on me and refocus and take some space. Read a little bit about leadership skills and really embrace my mental health. Could you imagine what that would look like sitting around a table and doing that? I really think it's important to think about companies unsticking themselves from convention and really embracing a new way of working. Another thing that's really important with a person-centered workplace is encouraging regular employee check-ins. Certainly a lot of us have regular meetings where we meet with our staff, but this is just a different kind of check-in where you're saying actually to the person, how are you feeling? How are you doing? How are things going in your home life? What's happening right now? Or, you know what, I know you've had a lot on your schedule lately and I'm concerned about you. Another thing that's really important is to make employee recognition a regular practice. We know that that's really important in workplace so that we're recognizing people who are certainly working hard, but also doing wonderful, valuable things. And again, be careful about what you're recognizing, not necessarily recognizing the person who works 80 hours a week, but maybe you're recognizing the person that had an impact on somebody's life. And that's the recognition. And always have fun with it. So remember, in Peace and Love Incorporated, there was a lot of laughter there and a lot of joy. And how important it is to over-communicate emotional support and mental health resources throughout the company. So again, it's not a matter of, I know that many of you come from the human resources field. It's not the matter of just calling human resources, but what if the workplaces were surrounded by mental health resources and people were encouraged to take mental health breaks and to maybe meet with their therapist and be in a private room so that they could connect with their therapist if need be. And think about ways to destigmatize EAP programs. EAP programs are so fundamental and essential, and we know that not enough people access them. And then really encouraging self-care practices and strategies and put them into the workday. So a lot of people work through lunch, they work through their breaks, they sit at their computer. What if in your workplace, everybody was encouraged to take a break and take a step away from their computer and eat together, or do a yoga class together, or take a mindfulness break? What if we encourage people, and I know a lot of employers are doing this now, to really encourage physical activity during the workday? What we know is that self-care is not selfish. A lot of us say, we're too busy. I'm too busy to take a yoga class. I'm too busy to learn how to meditate. I'm too busy to do these self-care practices. But again, what we know is that when we incorporate self-care practices in our day-to-day life, we are able to be better friends, better workers, better society members. So encouraging self-care. What if at the beginning of your staff meetings, you did pause and maybe took some nice deep breaths and you checked in with everybody around the table and everybody said what was going on in their lives and how they were feeling and how their mental health was. Some additional strategies. Offer paid mental health days. I really encourage you to think about this because what we know now is sick days are really important and essential. And we know that a lot of people use sick days for mental health days. Again, what if you were able to call in sick and say, you know what, I'm just not feeling right today. I need a day away from work. And what if your leadership encouraged that and took mental health days themselves? I was just having a conversation with our staff in the office, and I said, you know what, I've been really, really busy lately, and I'm going to take Friday as a day for me to rest. That's really important that I do that. So I'm taking the day off Friday to rest. And I encourage them to do the same thing. So also giving supervisors the authority to delay performance evaluations for employees who are struggling with mental health issues. Again, what if you said, you know what, we're in the performance evaluation cycle, but I know that you've been dealing with a lot lately. You've had a death in your family and you've had a lot of stress in your life. Let's delay this. Let's talk about this performance evaluation later on. And then how important it is to really train employees to recognize the early signs of burnout and discuss it with their staff. What if you were to say, you know, I've recognized that you're working a lot, and, you know, one of those signs and symptoms of burnout is, you know, that I've noticed that you've been short with people lately and you've just really been racing around here feeling stressed. You know, let's talk about what you need. And again, really building up this term, which is resiliency, and talking about it in the workplace and encouraging resiliency in the workplace. Resiliency is really that ability to bend with the wind, but not break in the storm. So it's really being able to bounce back from difficult circumstances. And another term that I like is really, it's called anti-fragility, which is not only bouncing back, but bouncing back stronger. So, you know, when teams really focus on resiliency and mental health, when you're having a bad cycle, bad news in the work day, something difficult happens, you know that those teams that have really built resiliency can not only just bounce back, but they can learn from those experiences and bounce back stronger. So what I wanted to just really talk about is how to handle a mental health concern. I know that happens for a lot of us. You're in the workplace. What do you do if somebody really has a mental health crisis or a concern in the workplace? What's really important is to bring them into a private place. You know, you can't have these conversations in a public setting. It's really important to have a private space. So ask appropriate open-ended questions. Can you tell me what's going on? Can you tell me how you're feeling right now? And then actively listen, really being present, asking questions. You know, and also validating the employee's feelings. It sounds like you're extremely stressed out right now. It sounds like it's been really difficult for you at home. Really demonstrating empathy by expressing understanding. So I hear what you're saying and I understand how difficult this must be for you. How can I help you? And then being able to share your company's mental health resources and encourage your employees to use them. And then I think what's really most important here is that we need to reassure the employee that they're going to be supported by you, the leader, by your team, and by the organization. So if somebody does disclose that they're really struggling in their home, they're struggling with anxiety, they're struggling with their own mental health, reassuring the person that they're not going to be thought poorly of because they're experiencing this concern. What we know with mental health is we're really talking about a spectrum here. We are all on this spectrum. For some of us, we may be doing really well and we may be functioning great in society. And what we know is that we may experience a crisis or a major loss, and that may cause us to be on a different end of the spectrum, where we may be experiencing a lot of anxiety or a lot of depression or a lot of stress. So if you think about all of us being on this scale or this spectrum, we know that we may be having a good day and we know that somebody else may be having a difficult day, and it can be vice versa. So let's think about ways we can encourage those conversations in our workplaces. And then what's most important for all of us is to model and practice healthy behaviors. So again, what if at Peace and Love, Incorporated, what if that CEO or that leader actually practiced these healthy behaviors, wasn't considered a workaholic, didn't work all hours of the day? What if that CEO took breaks, led that yoga class, helped people in meetings express their feelings well, and really took time out of their lives to practice healthy behaviors? What we know is that culture is created lots of times from the top down. So if leaders and organizations were modeling and practicing healthy behaviors, what that would do is encourage everybody to model and practice those healthy behaviors. So I just want to pause here. There's a lot of content, what I mentioned, and as you can tell, I'm passionate about this topic. So I'd like you to think really about what it would be like to really transform your workplace into a place that really promotes people's well-being and their mental health. There are some resources that you might consider looking into. Certainly a lot of the steps and strategies that I talked about would be helpful to think about incorporating. And these aren't easy fixes, but maybe talking about these practices within your workplace and how you might incorporate those into your teams. Another thing to think about is developing something called a trauma-informed workplace. We are really lucky here in Buffalo to have UB, which is a trauma center. So they do wonderful programs at UB in their trauma center, and they actually have a certificate to establish a trauma-informed workplace. I've taken all of those courses, and really it talks about how to be a better workplace, not just for your staff, but also the customers that you interface with. And another thing to maybe consider is what at MHA, Mental Health America, calls the Bell Seal. So the Bell Seal is a program that was developed in 2019. And what that Bell Seal is allows people to look at their practices in basically 5 different categories: workplace culture, health insurance and other benefits, wellness programs and perks, legal and ethical compliance, leadership and community engagement. And what we do at Mental Health America is we do an assessment. So we look at all those 5 categories and we assess the organization on those 5 categories. And then we help the organization develop healthier strategies and shift the culture. So by engaging with the Bell Seal, you're able to, again, grow and learn and develop, with the help of Mental Health America, more sustainable practices. Another resource that I wanted to leave you with is something that we do at Mental Health Advocates of Western New York, and that is we have this free anonymous online screening. I mentioned that we have a lot of programs at MHA. This is one of those things that we feel is really essential. So you can go on our website and you can take an anonymous screening and encourage your staff and coworkers to do the same thing. So that screening you can take for, if you're really wondering, is this normal? Am I feeling depressed lately? It feels like I'm suffering more than normal. You can take this online screening and it will score you. And then give you some resources and numbers that you can call. Certainly you can always contact MHA, and we are at 886-1242. We have an information and referral line. So when you call that number, you'll get a live person that will talk to you about your concerns and give you resources, information, and refer you to resources in the community. And also we do a follow-up call to check on you to see if you've been able to contact the person that you need to. So on our website, again, I'd encourage you all to go to it because it has wonderful resources, but also this anonymous online screening tool is really wonderful. A lot of people take this screening tool, and it's actually part of the national MHA screening tool. And what MHA has noted is that the people who have taken the screenings, that's increased tenfold during COVID. So they had a lot of people taking the screenings before COVID, but it's actually increased 10 times during COVID. A lot of people are experiencing a lot of stress. So I want to end with this quote from a new book that's out that I love. And of course, I always recommend people to listen to Brene Brown's podcast, which I love, called Dare to Lead. And this says the cure for burnout isn't and can't be self-care or just self-care. It really has to be all of us caring for each other. So we can care for each other in our communities, in our societies, in our churches, in our homes, and we can also care for each other in our workplaces. So here is my contact information. You can always reach out to me at my email or call me at 886-1242 if you have any questions, if you want further resources from me, or if you have questions about the organization or questions about the slide, just certainly reach out to me and I'd be happy to answer any of those questions. I want to just thank you for your time in learning about this really important topic. And I hope that you were able to take some things away from this presentation and really incorporate those things into your practices. So I think I'll pause here and see if anybody has any questions and open up the floor.
Great. Thank you so much, Melinda. Such an informative and timely presentation that you just provided to us. So thank you. We do have several questions that have been submitted by the audience. And as a reminder, if you have a question that you haven't yet submitted, please enter in the Q&A or the chat box and we'll get through as many questions as time allows. So the first one here, we have a question. What can an individual get help through MHA? So are there support groups that you have? You just sent that link for that screening tool. Would that be the direct line of action?
Yes, so you certainly can use our screening tool, but we also provide a lot of other resources. And we have a lot of adult support groups and that you're welcome to look into and join. So we have some kind of unique support groups which really focus on anxiety and depression. We've just started a support group for people that are struggling and living with schizophrenia. We also have an obsessive compulsive support group for people that are struggling with that issue. We have a special support group for people who are experiencing increased stress due to COVID. And one of our most long-running and established support groups is our writing and well-being support group. And that group meets on a regular basis. Actually, all of our support groups have been meeting remotely throughout COVID. And they meet weekly, and the writing and well-being workshop actually talks about and uses writing practices. So we have a lot of really amazing writers. It really focuses on their talent versus their mental illness. And we encourage people to write. We publish books on an annual basis, and we have a lot of published poets that meet regularly.
Wonderful. Great, thank you.
Sure.
From a physical office layout standpoint, are there best practices employers should focus on providing their employees? So for example, common spaces or natural light, things like that.
Yeah, what a good question that is, because there's a lot of focus on design right now, because we've designed our workplaces to look like one place. And now with COVID, I think that that's shifted for a lot of people. And again, I think it depends on your work environment. Having a lot of team space where people can get together and communicate and talk is really essential. But we also need some private space. So, at the MHA, we've moved to a new location at 1021 Broadway next to the Broadway Market. And we have both. We have group space, and we have space where there's cubicles. And then we have private space where people can sign out private offices. And those private offices are designed for one-on-one meetings, but they're also designed for people's private conversations, again, with their family members, with their therapist, somebody that they need to talk with and have a private space. So we've designed those and incorporated those into the workplace. So it's lovely to have a lot of shared space and open space and natural light. Super important, because we know living in Buffalo that we experience that, those dark seasons, and a lot of us experience seasonal affective disorder. Having natural light is wonderful. Having big open spaces is great. Having places where you can take a break and be in a private space is also essential.
Great, thanks, Melinda. Another question here. So you mentioned in this an earlier slide about burnout. Can you just explain what are those early signs of burnout to look for?
Sure. So burnout is a term that I think is really important to think about when we think about mental health in the workplace, because again, our culture really emphasizes striving, working hard, productivity. And what we know is that when we're not taking space out of our day to really incorporate self-care strategies, what we end up seeing is people and our workers and ourselves who may feel more disengaged from the workplace. And I'm sure you've all experienced this yourself or have seen this in your coworkers. People that say, you know what, I just don't care anymore. I just can't, I can't get up in the morning and I don't feel comfortable coming to work anymore. I look at my day and I think, you know what, I wish I could just stay home. This is going to be a terrible day. Or you find that somebody is being more irritable and lashing out at their coworkers, or not completing tasks, or taking off more time than they normally do because they just can't get themselves motivated to come to work. And in a lot of workplaces, that is the norm, and that is expected and not talked about. But those early signs are really when you notice somebody that has been going at full speed for a long time and doesn't take a break, or you've noticed that they're missing deadlines where they've never missed them before, or they're disheveled or more forgetful than usual, or most importantly, that feeling of disengagement. I just don't care anymore. I just can't figure out how to put my heart into this work anymore. I just don't care anymore. Those are really the early signs of burnout. And unfortunately, in a lot of work settings, they're ignored. And what we're encouraging you to do is really address those signs. And if you have regular check-ins with your workers, if you're meeting on a weekly basis and you're checking in from a mental health perspective, you're talking about those early signs. You're saying, the staff person is maybe saying, you know what, I noticed that the last 2 weeks where my schedule has been so intense that I haven't been sleeping really well. That I've just been feeling a little bit more discouraged than normal. That's not like me. And I'd like to figure out ways to kind of get back to the way that I used to be in the work and how I used to feel passionate and compassionate for my fellow human beings. So those are early signs. And I think it's an important thing to think about, really, what we can do. Again, incorporating self-care strategies and incorporating what's considered the stress cycle into burnout in our workplace settings.
Great. And this one, Melinda, is it's related to the previous question that I just had, but say it's a fellow employee that is in crisis at work. What's something that this person can do for them? Sure.
I think that's really important when we are talking about finding an advocate within the workplace, that, if we have a lot of opportunities to be able to be that advocate or that good listener. So if you're noticing that one of your coworkers is really struggling, just being able to create space for that person to talk about their struggles is really important. It doesn't mean that you have to be a clinician or a trained professional here, but if you were to, bring that person aside and say, I just noticed that you've really been struggling lately, that you've really been, I know that you had a death in your family and I'm so sorry for your loss. And let's talk a little bit. I'd like to hear what's going on. I'd like to be able to listen. I'd like to sit here next to you as you're struggling with the things that you're struggling with. And then if you have a culture where those resources, mental health resources, are available for that person, you can say, you know what, I know we have a really fabulous EAP program. I've used that EAP program before. They were great. You know, you might want to think about that. Or at MHA, they have a really cool information referral line. Do you want to call them together and see if there's a way that maybe they can recommend some counseling for you? Being able to sit next to a person as they're struggling and be a listener is really what we encourage. You may not have all the answers, and we don't expect you to have all the answers. What would we expect you to do is just to be a friend, be a good,
Right.
compassionate coworker.
Yeah, those are great tactics and good reminders. Thank you. We have two
Yes.
more for you.
Okay.
What if an organization is going to remain primarily work from home? How do you recommend we best handle staff mental health and well-being?
Yeah, that's a great question, because there are a lot of people that are going to choose to stay remote. And I understand that. It's harder to develop a culture when you're remote. Actually, I shouldn't say that. It's hard for me to establish a culture when you're remote. It's been a challenge for me, but there's a way to do it. And I think that there's some really best practices out there that I've read about. One of those things is to really encourage those check-ins, having those regular quick check-ins. And those, you know, usually when you're remote, they need to be scheduled, but prioritizing those scheduled check-ins, as well as prioritizing team meetings that are that incorporate some sharing and fun. What we know, I'm sure you've all experienced this when you were working remotely, is you basically go from Zoom meeting to Zoom meeting to Zoom meeting. And it would be important to really space out your schedule so that you're not doing that. So you're not jumping from one meeting to the next, but you're able to really say, okay, again, think about no meeting Mondays. What if you were to say, you know what, all of our meetings are going to start at 15 minutes after the hour, so that you have time to use the bathroom, take a break, do some breathing, walk around the block, and really encouraging those practices. And, you know, you miss that kind of camaraderie of walking by each other in the hallway, but you can create ways to do that in Zoom meetings.
Great.
And encouraging teams to meet together and have some fun.
Right, absolutely. Okay, last question, and then Marie will wrap up for us. Do you offer presentations to organizations or schools?
Yes, we do. So this presentation is part of a program that MHA has, and that's called the Mindset Program. And in the Mindset Program, we have presentations like this, and I can do this presentation for your organization, creating a mentally healthy workplace. We also do a presentation on easing stress in anxious times. And in that presentation, what we do is we really talk about the stress cycle and how to recognize signs of stress in your body, and how to complete the stress cycle and the connection between your mind and body. So during that presentation, we actually do some practices. We do some breathing, we do some meditation, and we encourage ways to move your body. So we have that presentation. We also have a presentation about, you know, about the effects of COVID in our communities. And again, another presentation on the mind-body connection. So again, MHA does these programs called Mindset, and they're available to anybody in the community. As you can imagine, the requests for the Mindset programs have gone up during COVID, and we've been so happy to be able to present these remotely, but we also can do them in person.
Great. Thank you so much, Melinda, for sharing your expertise and your knowledge. It's so extensive and so important at this time. And we hoped everybody today enjoyed the presentation. Next week, we will be hosting Tara Monahan, Esquire, Claim Counsel for Travelers Insurance, for a live presentation on cyber risks, trends, and response. And to register for this webinar and to view the rest of our lineup, again, visit walshduffield.com/summer school. And if you have any additional questions or you'd like to connect directly with the Walsh Duffield Wellbeing team, feel free to reach out directly using the contact information on the slide. And again, thank you so much, Melinda, for being here with us today. Thanks, and enjoy the rest of the day.
Great. Thanks, everybody.
Bye.